Hello, myself Neha Sagade, and today we will discuss about orthosis and regional classification of orthosis. So first of all, orthosis. What is orthosis? Orthosis are the mechanical or assistive devices which are applied to externally to the body parts, muscles or the joints, which will helpful for the correction of deformity, for the functions and etc. So now let's see the regional classification of orthosis. So regional classification is basically divided into type of the region in the body parts where we apply the orthosis. So let's see the regional classification of the orthosis. First of all, cervical orthosis. Then head cervical orthosis. Then head cervical. Thoracic orthosis. Then sacral orthosis. Lumbosacral orthosis. Lumbothoracic sacral orthosis. Then upper extremity orthosis. And lower extremity orthosis. Now we will discuss about these in cervical orthosis. So cervical orthosis mainly used when there will be any type of injury to cervical spine or fracture to cervical spine, or there will be any type of sprain or strain in the muscles of the neck. It will stabilize the part of the neck, and also there will be partially range of motion will be restricted and partially range of motion will not be restricted. Some of the movements are restricted based on the which orthosis we are using. Now head cervical orthosis. It will stabilize head and cervical spine. It will mostly used in the fracture of cervical spine because it will restrict all the movements or all the motions of the cervical spine. It will be more used for the stabilization of cervical spine. Now we will go for the head cervical thoracic. Mostly head cervical thoracic spine will stabilize or useful when there will be, we have to stabilize the head, cervical and thoracic area. Three of them together. Mostly halo device will be used in this orthosis. Now these are the head cervical and head cervical thoracic orthosis. Now sacral orthosis. Sacral orthosis are mostly for the stabilization of the part of the sacrum, or we can say the pelvis part. It is mostly useful when there will be any type of low back pain or mostly in this sacroiliac pain. Now lumbosacral. It will mostly useful for the lower back pain. It will stabilize the lumbar part of the spine and sacrum. Now thoracic lumbosacral orthosis. It is mostly useful when there will be need of stabilize the thoracic spine, lumbar spine and sacrum of the body. It will mostly useful pre-operatively or post-operatively stabilization of the spine. Now these are some sacral, lumbosacral and thoracic lumbosacral orthosis. Now we will discuss about upper extremity orthosis. It is also divided based on the region, like for the shoulder and arm orthosis. Now for the elbow orthosis. After that wrist orthosis. Then after that there will be hand orthosis. It will be divided by the any type of deformities or any type of injury to the parts, like for the shoulder and arm injuries there will be shoulder and arm, for the elbow, for the wrist and for the hand. Now we will see for the lumbar lower extremity orthosis. For that there will be foot orthosis, ankle foot orthosis, knee ankle foot orthosis, and hip hip, knee, ankle, foot orthosis. Shortly, these are known as KFO and HKFO. So, as we have known now, these are the classification based on the region where the orthosis is applied or fitted. These are some of the lower extremity orthosis like foot orthosis, ankle foot orthosis AFO, knee ankle foot orthosis KAFO, hip knee ankle foot orthosis HKAFO. Based on this video, we have summarized all the regional classification of the orthosis.